Thank you, Rich, and thank you, everybody, for joining us today. Before we get started, I want to say just a few things. Number one is, to Rich Walensky, I want you to know how much the community appreciates your leadership and that this is a very important time, and we hope that you will stay strong and be there for us and so that we can work together to end the epidemic. Number two is there are over 950 people who registered for this webinar. In order to be able to facilitate that discussion, what that means is that everyone who's on the webinar is on mute. You will be able to ask questions at the end of it, but we're going to ask that you ask those questions if you look at the formatting of this in the chat section. So as we're moving forward, if you have any questions, you'll post it in the chat section. And at the end of the webinar, Dázon will be facilitating a discussion based on the questions that you're asking during that time. Number three is that I know there are also many federal partners who are on this call. And so as we acknowledge community, I also want to acknowledge our federal partners and federal employees who have a very challenging job to work to end the epidemic and know that community is supporting you in our collaborative efforts. NMEC believes that undetectable equals uninfectious, that treatment as prevention and PrEP have given us real pathways to end the epidemic. All we have to do is look at what's happening in New York, San Francisco, and Massachusetts. Unfortunately, the promise of the new science has not been seen equally in all communities. At NMEC, we are particularly concerned about people of color and want to make sure that they benefit from this science. I want to give a brief plug to our Biomedical HIV Prevention Summit that is going to be happening in New Orleans on December 4th and 5th of this year. We really strongly encourage community to come to the summit. It will be an opportunity to look at how we can all work together to build pathways that support the diversity of communities highly impacted by this disease. With that commercial, let me introduce our first speaker. Our first speaker is Dimitri Dakalakis. Sorry, Dimitri, I got it. Ruined that one. Dimitri is the Deputy Commissioner for the Division of Disease Control for the New York City Department of Health and Mental Hygiene. He is an infectious physician who has focused his clinical and public health care on HIV treatment and prevention. He currently serves as the Deputy Commissioner of the New York City Department of Health Division of Disease Control. So with that, I'm turning it over to Dimitri.